Good evening, all. My name is Regina Wilson, and I'll be your moderator for today's community conversation, where we'll discuss youth vaccines. Thank you for joining us. Today's conversation is being presented by Vaccinate All 58 and California Black Media. It's for almost 2 years, the statewide COVID-19 awareness campaigns have executed several community conversations comprised of medical experts, community advocates, education administrators, and personal testimonies. These conversations are designed for open dialogue that will hopefully help those listening make a decision around informing how they will work to get vaccinated or boosted. The pandemic has been hard for everyone, both young and old, and we want to encourage you to do your part and remember vaccination remains the safest way to protect yourself from COVID-19 and reduce its impact on yourself, your family, and community. As I mentioned today, we will focus on youth COVID-19 vaccines. This is an important conversation, particularly when we hear stats such as Black children in California are the second most likely to die from the virus among Californians younger than 18, with 1.2 deaths per 100,000 Black children. Today, we're excited to be joined by Dr. Oliver Brooks, a leading voice when it comes to efficacy and safety in vaccines, and Dr. Ramona Bishop, an education leader and charter school operator. Before our panelists briefly come on, we want to briefly introduce and have them briefly introduce themselves. We have a special guest who has graciously agreed to share her personal story on why she chose to get vaccinated. Miss Alyssa Phillips attends Trawick Middle School in West Covina and is in the 8th grade. She is a 3-sport athlete who maintains a 3.3 GPA and spends most of her free time painting or volunteering for school projects. Thank you, Alyssa, for joining us. So I just want to bring you up to the discussion. You're there. I think you're on. I think you're unmuted. When the vaccine was first made available for 12 and older, had you already made your decision to get vaccinated?
Not really. I didn't really want to get vaccinated at first because I didn't find a need for it until I figured out what it means for everybody around me.
Okay. And tell us a little bit, what led you to that? I mean, do you have grandparents that you're visiting or other folks that may be immunocompromised? What led you to make this, kind of grown up decision?
I'm around a family and friends a lot, and I wanted to get vaccinated so I can play sports and go visit all of my family members without having to risk them of getting the virus.
Well, you know what? I want to thank you so much for your transparency, Alyssa. And, we appreciate your story. We hope it made an impact on others listening, and being able to share your experience is, I think, always valuable to have others hear from people who have made the same choice. So, thank you so much. And I'll let you go back. I know that you can't stay around, but I'll let you go back to playing sports or volunteering like you do. And thank you so much.
Thank you for having me.
Before we jump into the conversation, let me formally introduce our panelists. We first have Dr. Brooks, Oliver Brooks, who's the Chief Medical Officer for the Watts Healthcare Corporation, received his undergraduate degree in biology from Morehouse, our HBCU in Atlanta, Georgia, and his medical degree in 1981 from Howard University College of Medicine, and completed his residency in pediatrics at Children's Hospital, Oakland. Dr. Brooks is the Chief Medical Officer and past Chief Pediatric and Adolescent Medicine at Watts Healthcare Corporation in Los Angeles. He's also the past chairman and community of the Community Clinic Association of Los Angeles County, a consortium of 43 community health centers in the Los Angeles, California area. I could go into this, all the things that you've done. You've also been the past president of the National Medical Association, so you definitely have the the background to really speak to us tonight. And we know we're talking to somebody who really knows what they're talking about. You are also the past president of the California Immunization Coalition and chairman of the Immunize LA Families Coalition, just to name a few. Next, we have with us tonight, Dr. Ramona Bishop. She is a firehouse educator. I call her the cleaner. She comes up and cleans up the mess of people. I'll stick to the bio for a second, but she has been a powerhouse in what she does in leading and making sure that kids are getting a proper education, especially our Black and Brown kids. Who are struggling. But Dr. Bishop graduated from John F. Kennedy High School in Richmond, received her Bachelor's of Arts from California, Berkeley. She earned her teacher credential from the University of San Francisco, and she earned her Master's of Administrative Credentialing from the California State University of Hayward. She was also awarded her doctorate in Educational Administration from the University of Pacific. She has served as the superintendent of Vallejo Unified School District, as the Associate Superintendent of Educational Services, Twin Rivers Unified School District. Let me just add, because this wasn't her bio, she took them out of receivership. So that meant whenever the state took them over, she came and fixed the school district and brought grades up and got them fiscally together. Most recently, Dr. Bishop worked with the I think this Vallejo Community Unified School District staff to implement innovative research proven strategies while removing the district from the state control, which is what we talked about. Simultaneously, staff implemented programs that are receiving state and national attention and having a strong impact on student outcomes, including but not limited to wall-to-wall career and career academics for high school students, full service community school district, system-wide implementation. And she is also the co-founder of Elite Charter Schools. That is her latest venture that she has taken over, and she's doing amazing things in Vallejo. So thank you both for being here and getting ready to just dive in so that we, once again, can have people talking. I know today I dropped my kids off with uncertainty and talking in the car on the way home saying, do you wear your mask or do you not wear your mask? And so, the first, kind of question, Dr. Oliver, since we have you here, are COVID vaccines safe and effective for kids? And then we'll get back into my question about should my kids have on their mask still or not?
So good evening, first of all, Ms. Wilson. I'm glad to have you here posing us questions and hosting this forum. That young lady, Alyssa, showed more wisdom than many people that are much older than her have shown to me when they talk about the reason to get vaccinated. She showed a caring for those around her. And I really appreciate her perspective. Getting to your question, the vaccines are safe and effective for children. I might add for adults also. They were studied extensively in the older age group, and then in the younger age group, the studies actually showed that children respond even better than adults, which is generally true understood. Some males, anywhere from 18 to 40, had developed myocarditis or pericarditis, inflammation of the heart. Now, that happens. All of those children recovered. It was mild, no long-term consequences. I want to know, children that get COVID-19 can get the same thing. Those children end up in the hospital with potential long-term consequences. So I want parents to know that they definitely should get their children vaccinated because the vaccines are safe and effective.
Well, I as we're talking and we're staying on this topic and we think and we talk about what parents and stuff are facing, Dr. Bishop, to bring you into this conversation, even around this question, because I'm sure that you have this, your school has, what is it, K-8?
We're K through 11 now.
K through 11. So everybody that you're talking about, Dr. Brooks, is the people that she's looking at. And I'm sure that if we looked at the numbers in Vallejo, I'm imagining because of the population, these might be people who are skeptical or have just said, you know what, I need more information. So
Yeah.
Dr. Bishop, what are you seeing at the school right now and the receptiveness, or are you guys seeing that people are being receptive?
So I think that's a really good question. You're a parent, Regina, at this time, and you know that parents have received a lot of information from a lot of different means, whether it's CNN, whatever it is they're watching for their news, and there's a lot of questions. We have a great expert here, Dr. Brooks, we believe him, but our parents are believing whoever is in their ear at that particular and given moment. And so we have seen everywhere from the parent who saw the vaccination come out and had their child in the clinic and or the doctor's office that week, to the parent who is saying, I will never get my child vaccinated because I'm not convinced. And, our tact has really just been to try to follow the lead of the parent while giving as much information as we can. So we had a partnership with Merritt College. We continue to have that partnership, and those nurses were focused on sharing what's really going on with the vaccine. What does the research really say so that our young people could actually hear it firsthand. And, speaking of the mask mandate, that's a whole different conversation about, just because the governor says we should relieve the mask mandate, should we at our school do it? So those continue to be conversations we're having in conjunction with our community, because it's not really what the truth is, it's what our community believes is the truth that is guiding their decisions right now. And you're right, Dr. Brooks. The young lady was very articulate in saying, I want to keep grandma safe, or uncle or auntie. And yet, we still have people who are hesitant.
Right. So, Dr. Brooks, since we're here and obviously parents are watching, I'm sure that one of those questions that parents might have is the kids vaccine different from the adult vaccine? Is there a different dosage? Is it differently formulated?
Right. So it is a different dosage. It's less. The dosage is 20 micrograms instead of 30 micrograms, if you want to know. For a couple of reasons, children are smaller, so they get lower doses of medications. And again, their immune systems are so ramped up and so responsive to challenge, which is ultimately what a vaccine does. It challenges the immune system. The immune system says, this is something bad. I need to make antibodies to it. And the kids respond just like that. So other than that, the formulation is the same. So the other thing, the point I'd like to make for those that are still hesitant, as Dr. Bishop referenced, is that in the United States, we've given over 500 million doses, okay? So if there was something strange or wrong or, under the surface about the vaccine, we would know about it. Number one. Number two is I sit on the panel at the CDC at the national level that actually makes the decision. There's only 15 of us that sit on that panel in the country. We say yes or no. I've seen all the research, and I want to add that Black people were in the research. We haven't always been in the research, but we were strident when I was president of NMA, which is the time the studies were going on. Did we get Black people in the studies? So we were in the studies. So we know the vaccine is safe and effective. We know it is safe and effective for Black people. And the studies showed that it is safe and effective for Black children. I didn't reference your mask mandate. I kind of agree with Dr. Bishop said. The governor can say what he wants. People can say what they want. I'm still wearing my mask. I think I'm just a little cautious. It took us 6 months to convince people to wear masks. Now we're not supposed to, but it's also based on science. I understand why they're saying it. The number of cases has dropped dramatically, and I'm very happy about that. I think once I see the environment open up more, let's say a month from now, when people have stopped wearing their masks, if I see the rates continue to fall or stay low, then I'll feel more comfortable. The virus is just not circulating as much. It's not as many people out there with it. So I hear exactly what Dr. Bishop is saying, however, that for right now, she feels more comfortable theoretically having her children and or her people, in other words, herself and her family, continue to wear their masks.
So as we, and I'm popping back and forth between what her reality is what she's seeing from a reality, and then what you do on a daily basis. So just know that that's how I think it, obviously helping to engage and keep the conversation interesting for folks. I'm thinking about, when we look at this, will kids kind of face or see the same symptoms that adults felt? I know whenever I took actually my vaccine, I will say that I was skeptical at first. And then when I took it, I was like, my arm was sore. I went to sleep. And the amazing part about it is when I woke up, I had more energy than I've ever had. And I cleaned my entire house. And there was a joke. There was a joke that I was like, wait a second. How did I clean my entire house? And it's kind of it's a joke because we're living in a place right now where it was a little oversized than what our family needs. And when I cleaned, I was like, I cleaned the bathrooms, I cleaned everything, I vacuumed. I mean, I did everything. So, I didn't experience negative side effects, but would kids, experience negative side effects?
They can. So the side effect profile is more or less similar to that of adults. Local, something that happens right there in your arm, redness, swelling, and pain, very common. The ones that happen through your whole body, like fever, fatigue, headache, those also occur in children. Children also have some of the GI symptoms or side effects like diarrhea, vomiting, stomach upset. What I like to underscore, however, is the symptoms of COVID. So where you two get COVID because you weren't vaccinated, you can get respiratory distress and pneumonia and overall inflammation and end up in the hospital. There are over 8,000 children that have died from this. There is a syndrome called
Is that over?
No,
8,000 in California, or that's globally?
Overall, yeah.
Okay.
So, no, US, not global. So
okay,
it's real. I think the other thing that people that are skeptical may forget is that you can get COVID and maybe not get hospitalized or die or not be really sick. But this concept that you all know of called long COVID, which means that you have symptoms of COVID 6 months after your initial infection. And children can get long COVID, and we have no idea what to do about it. So what would you do if 6 months later you're having headaches and fatigue and you couldn't think straight? I mean, and the doctor said, no, I can do for you. Good luck. So I think that we need to remember that we are more afraid of the solution than the problem. So we all have to have a healthy respect. I guess as a physician, I have a healthy respect for what COVID can do. I've seen the patients in the hospital on ventilators. So that's not good.
So do you also think that, we've heard a lot of people talk about, just this idea of infertility and the things that you've seen on TikTok. I got, Dr. Bishop, I'm sure you have witnessed people say, no, I saw on TikTok that you could you become magnetized to you. And I know that they said, oh no, don't, I don't know if TikTok ever took that down, but people were, that was kind of a running thing. So, but I think that, there was a study that came out, I think, not recent, well, maybe kind of recently, but a few months ago, I felt like I read that they said, that menstrual cycles were changing. Are you seeing, Dr. Bishop, that young girls or mothers of young girls are saying, hey, I'm nervous about this for that? And Dr. Brooks, the same way. What's the truth behind the fertility issues with COVID?
You are
I want Dr. Bishop to respond first, please.
The impact of TikTok on what our students and their families believe is reality is significant. And so I've heard it all from, young ladies will be infertile. I mean, I've heard everything under the sun that you can imagine. And our nurses have had to go in and just say, hey, that is not factual. It's not factual. So absolutely. I think the other one that we heard that we've been guarding against, which is why we are continuing with our masks, at least for now, is that children can't get COVID-19 nor transmit it, right? And Dr. Brooks just told us a number of students who have died US-wise. So that matter, we are actually testing our kids once a week and sometimes twice a week. And so we have those numbers as far as what that looks like. Before the holidays, we were able to get it all the way down to we had 0 cases in our school. After the holidays, you hang around with your family and you are or are not vaccinated, and then the numbers climb. And so again, we've been guarding against all those myths, including the ones that you lifted up, Regina.
Right, so the vaccine does not affect fertility. And the American College of Obstetrics and Gynecology, the ACOG, of which I know one woman who is a sister who is on the board, has recommended that pregnant women get vaccinated. Pregnant women are at higher risk of illness and death from COVID. All women should get vaccinated. I am concerned that, first of all, people are looking to TikTok for healthcare advice. And so we need to think about that in and of itself. I mean, if we get past COVID, what about hypertension and diabetes? Okay, I hear eating sugar actually makes your diabetes go away. I heard it on TikTok. I mean, so we need to more fundamentally even start to address the concept of, as Dr. Bishop said, where people get their health information, because there are a lot of sources of information right now, more than ever before. There was no such thing, wasn't even internet when I was growing up. Not even when I was in school. So, it wasn't there. We got information from where we could get it, books, newspapers, and people, basically. So we need to ensure that our people, that's who I have the most concern about at this moment, because we have the highest rates of death and hospitalization, COVID, and whatever you name, our people need to get their information from trusted sources.
Right. And, are there any kids that you think shouldn't get the COVID-19 vaccine? I don't know if there are kids that, Dr. Bishop, I'm sure you probably have people who come and say, hey, my kid's going to have an exemption. And Dr. Brooks, I mean, I think you could probably spell out for the kids who, maybe immunocompromised, maybe have cancer, I think there was a conversation around people who, would go through dialysis and they would lose their blood and gotta go through that whole thing. Are there any kids that shouldn't be at this time that you guys know of that shouldn't actually be exempt?
No. The only reason not to get vaccinated is if you had a bad reaction to a prior vaccine, COVID vaccine. The cases you noted are the people who need to get vaccinated first. Because if you're immunosuppressed or you have cancer and cancer treatment, organ transplant, these kids may have leukemia, which you see in children, their immune systems are weak. So if they get COVID, they're the ones that are going to end up in the hospital. So they need to be at the front of the line. The issue is that they may not respond as well to the vaccine because their immune system is not as ramped up. So actually for a certain subset of individuals, both children and adults, you need extra vaccine as opposed to no vaccine or less vaccine. So no, I mean, the people, the public, parents, families need to understand the vaccine is safe, effective. It doesn't do anything like that to you. Okay, there's some vaccines like a measles vaccine, chickenpox vaccine, live vaccines that you don't take if you're immunocompromised or pregnant. But for the COVID-19 mRNA vaccines, which are the ones that are for children, you get them, okay?
Good. And Dr. Bishop, are you seeing people who are opting out and saying, hey, no, I'm going to get my exemption, whether it's religious exemption or whatever? Are you seeing, I mean, I know that you guys have to follow kind of like what the state does, but I don't know if the school is being put in a position to try to have to figure out how you will guard against or honor exemptions.
Mm-hmm. We're definitely thinking about what that looks like as the mandates for vaccinated students come down. We are hearing, families, and I love what Dr. Brooks clarified, that immunocompromised students should be at the front of the line, not the back of the line. So those conversations are being held with our families that lift up that idea. We even have staff members who are saying the same. I'm immunocompromised, I shouldn't get the vaccine. So those conversations have to happen. But we're really just sending them back to their doctor now, just check again, because we're not qualified to give that judgment or to guide people in that way. So we're really relying on the medical professionals, our nurses and so on, to send that message of safety, of what the vaccine can and cannot do, and of confidence, right? That the research was done in our communities. That's another misnomer, that Black people didn't participate in the study. You remember referring to all the historical events that really don't have any bearing on what's happening now.
Right. So, Dr. Brooks, what happens for the kids that may have already gotten COVID-19? I mean, Dr. Bishop, I'm sure you've seen the kids in your school. You probably had a number of cases of people who you've had to send home. Dr. Brooks, first, do they still need to get the vaccine if they've already had it? And if they've already, and Dr. Bishop, I want to see if if any of your students have even had it twice or not.
So the answer is absolutely. And the way I try to explain it is this, okay, you need an immune level here. I either call it antibodies, but there's actually a lot more to your immune system than just antibodies, but that's what we talk about. You need it here. So when you get COVID, you shoot up to here, you have strong antibodies, you're protected. Over time, drops. So now you need to be here, your antibody level is here, which is not protective. You could get COVID again because you don't have enough. A booster or vaccinating pushes it back up. And then if the primary series drops, boosts back up. So we're not to the point where we know that the booster is going to drop. We have to get another one. But the information coming seems to be that we're likely have to get vaccinated once a year or so. Same way we do it with influenza. So yes, children can get it. COVID, they have gotten, obviously children can get it. But if they get it, they absolutely need to be vaccinated. If they're fully vaccinated and they got it, then they're cool. It's important to understand the whole reason for getting vaccinated in terms of the studies and the work that was done by Pfizer, BioNTech, and Moderna, I guess in J&J also, was to prevent you from getting hospitalized or dying. So it also helps to stop you getting COVID, but the key is don't get hospitalized, because if you don't want to be in a hospital, you don't want to be in a, trust me, and you don't want to die. So those children that got it, most of them, probably 99% of them didn't get hospitalized or die. But if they were unvaccinated, you're more likely to have problems.
And Dr. Bishop, like how many cases has, you have a small community school. So how many cases did you see during this time? Did you see a huge uptick in people having it during this Omicron? Thank goodness we're on the down cold of the Omicron, but did you see an uptick, and did you see kids getting it multiple times, between now and I guess maybe whenever you guys started going back to school? Because did you guys start going back to school at the beginning of the school year?
Of the school year, yes. And we did see an uptick, like I said, after the holidays. It was kind of a holiday plus Omicron situation that was going on. And many of the young people, because our families have been amazing, right? If you have any symptom that looks like it might be, keep your child at home, is what we've said to them. So it may be that there were students who actually had it, but we didn't test them because their parents did the wise thing and kept them at home while they were symptomatic. Did we have students that got it multiple times? I have not heard of such, but I did hear of students who were vaccinated and got it. And like Dr. Brooks said, and I think this should be underscored for everyone who got the vaccine. A lot of people are saying, oh, well, I thought that if I got vaccinated, I wouldn't get it. Nobody ever said that. When I was vaccinated, they didn't say that. They said that it was going to be guarding against some of the symptoms potentially and guarding against me dying from COVID. That's all I needed to hear. Give me the vaccine, give me the booster, give me the next booster. So anyway, long story short, yes, we've had students get it. Yes, some of our vaccinated students get it. No, we didn't see necessarily those repeat cases. And yes, really working with the families to make sure that students don't come when they have any symptom has helped us.
Great. So Dr. Brooks, there's obviously debate around this and what parents are doing. And I know that there's legislation, not to get into any legislation, but will a parent or will a student need to provide consent or be present for their child's COVID-19 vaccination at this point?
Yes. So under 18, unless you're emancipated, your parent does need to provide consent. There are some vaccines where they don't, hepatitis B, HPV, because they deal with STI, sexually transmitted illness. But for the COVID-19 vaccine, yes. And I think it is reasonable. I'm a trained pediatrician, so this is right up, what I do. And I believe it is reasonable, except when you have someone like Alyssa. Let's say Alyssa's parent didn't want her to get vaccinated. She said, and again, we see children that want to get vaccinated and the parent doesn't want them. So that's when I, as a doctor, feel a level of frustration. But yeah, it is by consent of the parent. Because let's say if the kid has a side effect, the parent needs to know about it. The parent needs to be there to take care of the child. Parent needs to be aware of what's going on with their child until they're 18 in this state. And then after 18, it's on the child now, with the young adult at that point. And you mentioned about getting COVID-19 twice. I mean, it happens. I mean, anything can happen. I always tell people, don't forget, this is biology, okay? Biology is unpredictable, okay? Physics, I know, if I go 60 miles an hour, it's 60 miles an hour, not 61. Biology, anything can happen. So that's the other thing I like people to understand, that, we can't make, ironclad promises. We can only look at the information, look at the data, look at what has been going on, therefore what we predict to happen. And so far we predicted right. I want to underscore that there are 900,000 people that died from COVID in the United States, almost 1 million. So do understand that this is an important thing. I mean, it's now with Black people, I believe COVID is like the 3rd leading cause of death, something like that. It's very high, maybe 5th, but that's how bad it is. So I don't want these families to take it lightly. And the last thing I'll say, unprompted, is that the best predictor of whether a child will get vaccinated is whether the parent got vaccinated. So parents that did not get vaccinated, generally speaking, are not going to have their children vaccinated. And parents that are vaccinated, generally speaking, are going to have their children vaccinated. So I focus on the family, not just the child, because if I can convince the mom to get vaccinated, she will likely go on and get her child vaccinated. I don't know if that's what Dr. Bishop has seen also, but that's what some of the studies show.
So, and do you think that there will be more options in terms of vaccines, or will Pfizer be the only option?
I think that likely Moderna will become an option. As to do station, talking about getting down to age 5 to 11, I believe Moderna will be up there. As it relates to other vaccines, other than the 2 mRNA vaccines that we have, for the Johnson & Johnson going down, no. But honestly, well, for me anyway, I don't see the need. I mean, the vaccine is safe and effective. So if you come up with another vaccine, other people that don't want to get vaccinated just have another excuse as to why they're not getting vaccinated. Ultimately, it comes down to fear. And it should be understood that it's not objective and scientific. I cannot show them graphs and quote figures. They're afraid of something. They're afraid of the vaccine. They're afraid of needles. People forget that. Some people are just afraid of needles. So they use all these other things, to say it. So you got to get past that fear. And that's an emotional, psychological thing, not a scientific, objective, logical thing.
Well, that's what I've always said to people, that the needle thing, it gets me too. So I will go ahead and be honest in this whole conversation, the needle thing. But I was in Sacramento and I had a pastor, one of the churches said, Regina, if you come in, I can get you in right now. And I think this was at the time whenever it was hard to get a vaccine. I drove from Sacramento to Oakland to actually go do it. So I said, you must have really been talking to me, because I didn't want to make this drive on my own. And so, but it was also the conversation. It was, talking, it was just I think probably Dr. Bishop, and you probably can relate to this, is being able to meet people where they are and talking to them so that you can get them to a place of a comfort. Because if they don't feel comfortable, they're not going to do it. So I think you probably can speak to what you guys are doing, probably even at the school, to get people comfortable. And is that by like bringing the nurses in, you know, talking to them, meeting them where they are, even if you're like, oh my God, I can't believe they believe some of the stuff they believe, you're not disparaging them. Are you taking the time to at least be able to say, let me have this open dialogue so that we're able to have this conversation? I mean, do you see getting headway there with some of the population at your school?
That's absolutely true. One step at a time. And, you know, if mom or dad are not receptive, grandmother and grandfather have been very convincing during this time. So just one step at a time, one family at a time. We have a lot of our families who, when they get their child vaccinated, they're posting about it. You know, it wasn't so bad, that type of thing. So a lot of that, you know, they trust each other. And it's really just going to take a little bit more time for us to work into an understanding that this is not a bad thing. It's actually a good thing.
And you know, Regina, you said something crucially important. You said meet them where they are. All of the studies show that to get people that are hesitant to get vaccinated, step one is figuring out where they are. If you don't do that, you will not get them vaccinated. So I want to underscore what you said it kind of casually, but that's the everything right there. You got to meet them where they are.
Well, you know, it's one of those things that I've always said too, is that, you know, I don't push it on people. I can encourage them and tell them about my experience. But I understand, like, it is about meeting people where they are, especially if you are like, man, and now if you would have given people, if Pfizer or J&J or Moderna would have created something that you could just squirt up your nose, man, this would not be an issue. People would be like, okay, it's not as invasive. But the needle part is so invasive that I think that, you know, there's a fear of, like you said, there's a fear of needles, there's a fear of the unknown. And so like you said, it's that's why I said it's like meeting people where they are and not disparaging them. And almost like, I know that there's a rush to make it happen, but you almost can't even seem like you're trying to rush people. So you got to figure out how to talk to them without rushing them, but still creating that urgency. So
can I add to that,
yeah,
Regina?
yes.
We were home. Our families were home for a whole year from school. And so parents were ingesting information from people without the expertise that Dr. Brooks has, right? And so we're really undoing a lot of that misinformation that was out there. They were watching people say, it takes X amount of years to create a vaccine, and then the vaccine appearing. They were watching people be hesitant around this whole conversation. We all had no idea what was going on at the beginning of this. And parents were in front of their TV 24/7 because they had to be, because they were there with their children. And so it is going to take a slow and steady pace to really get everybody to their own understanding of what it is that they want to do for their child, because ultimately it is their child, so they have to make that decision.
Yes, and importantly also having all of us speaking with a similar message. I mean, I will say it slightly differently than Dr. Bishop. We all each have slightly different perspectives. But there's an organization or a project called A Shot of Faith where we speak to the faith community. And I just think about the fact that you said, Regina, you drove from Oakland to Sacramento, and I'm proud of you for doing that. But you got it from the faith community. So we have, you know, a doctor in education, a doctor in medicine. We have you. I mean, the faith-based community, I'm saying you represent that just by what you said. And we need to hit them from all angles, and they need to hear the same thing over and over, the same way Madison Avenue works. You know, they'll advertise for Pepsi in 9 different ways, but it'll almost be the same message. That new Coke Zero, is this the best Pepsi ever? Something like that. Or was it? I don't know, Coke or Pepsi. I honestly don't know. But they'll say the same thing over and over and over. And we have to have that same approach. So having forums just like this is crucially important to getting the message out. Because I'm not giving up on my people. I'm sorry. You know, I'm not at the point where, you know, good luck, too bad. You know, I want every Black every child vaccinated. I want 100%.
Well, no, I totally understand what you're saying. So, Dr. Bishop, a little bit like for administration, is your administration right now, are teachers and administrators, staff, are they required right now to be vaccinated? I know that there was a full on, some people were, some people weren't, but are they required at this point?
They are not required at this point, but we do weekly and sometimes twice a week testing on all staff, including those that are vaccinated.
Okay.
So your staff are not required to be vaccinated?
No, sir, but next year they will be. Mm-hmm.
Okay.
I wasn't sure that, I know that there were these varying laws that were kind of, contradicting each other. So, I wasn't sure. So, so as we just kind of like look at this and we really, dive into a little bit more on maybe like just new information. I know that I'm in the news business and I will wake up and I'll look. I think today I even saw that Pfizer said, we're going to need a 4th dose. I'm not sure if you like saw that or read that, or if this is just something that's on there, but what do families need to know now? And are we going to find that people are saying, wait a second, why do I need another dose? I just got another dose. What are we doing for those folks that were saying, hey, we're going to need a 4th dose, versus people who are, like we're talking to, that are just trying to get their 1st dose? Dr. Brooks, how are we, how is that messaging going to play out?
So, and that is a bit of a challenge. I go back to biology. I mean, if you think about it, okay, this virus, its first case of virus in the US was in January of 2020. So we're only 2 years into this thing. We didn't even know, we knew, coronaviruses existed, but there was no SARS-CoV-2 that was going to end up killing, almost 1 million people in the US in 2 years. So it's developing. We know that the vaccine is safe and effective. So then we have to figure out how to use it. So that's really important. So you have a cleaning agent in your house. Well, I know this is, it seems toxic, but it's not. It's safe and effective. Now, where do I use it? How often? Do I have to wash the floor once a week? Or is it such a good cleaning agent, I have to do it every 2 weeks? So we're just learning about this. And like I said, I believe that ultimately you're probably going to need to get a shot once a year. I mean, that's kind of where we're headed. And the simple thing is because your immune system, for some reason with this vaccine, it just doesn't stay high. And that's the same like I say with influenza vaccine. That's not a novel concept. So what we need to do, honestly, to me, is let people know that we're watching. We are watching minute by minute, hour by hour, day by day. I even tell them to look back at the J&J vaccine that was pulled from the market for about a month because we found some issues within it being on the market for less than a month. So I sit on the panel that looks at this stuff. I don't get paid by the pharmaceutical or vaccine manufacturer. I can't even be on that panel if I had any money coming in from them. So I don't have a dog in this fight other than making sure people are safe. So I think what people have to understand is that it's developing over time. But I don't want to hear, oh, y'all don't know what you're doing. You first say this, then you say something else. No, there's a timeline and you can look at it. It's over time, it's developing. First, you just had 2 shots. Then you had to get a booster. Then immunosuppressed people had to get another shot. And so, I mean, it's just, that's the way the science is playing itself out.
And so, with that, and as we talk about just the way the science is playing out, do you think that it makes it difficult having science play out in real life? Like, right, with social, like you said, you grew up, there was no social media. When I was in college, I couldn't stand social media. I was in college. I think social media hadn't even come out yet. I think by the time, I think I graduated college and there was no social media, thank goodness. No trademarks of any of the things that I may have done wrong in college. But it seems as though, do you see this being a problem playing out, us watching science play out? Or is this just kind of like, hey, this is what transparency looks like?
Yeah, I would have posed that question to Dr. Bishop, because she's not a lay person, but she is when it comes to immunology and virology. Okay, so I'm curious as to how other people perceive it. So
Yeah.
I would ask her to answer that question.
Thank you. Thank you for the punt, Dr. Brooks, because I was thinking I probably should take this one. Yes, Regina, you mentioned mandates, right? So speaking of watching science play out, the mandate is for all students, I think it's grades 7 through 12. I know it's secondary, to be vaccinated this coming school year. So that's by the time students start this year. And then I believe the next year, and it phases in as far as the rest of the student population. So we're still getting people comfortable and confident with the vaccine while saying there is a mandate coming down. It's similar to the mask mandate. Who asked me whether it was time to eliminate the mask mandate? We got no such memo from anyone. And yet it's gone, and parents, it's funny because none of my parents have come and said, please eliminate this mask mandate. In fact, can we get more masks? And do you have more gloves? And so I think watching science play out and being sometimes what seems like, and I'm not speaking of Dr. Brooks, I'm really speaking more of just these things that seem to come on high from somewhere. Makes it very difficult on a day-to-day basis because there seems like there's an authority figure telling people what to do, and yet that authority figure is disconnected from the very community that is asking me the questions. So we've stood in the gap and really tried to make sure, again, that we're educating people about the merits of whatever the doctors are saying at that moment, that we are providing medical professionals for people to talk to should they want to, and then that we're being reasonable. And that, for example, the mask mandate, we have sent out a survey to all of our families. What do you think about the mask mandate? Should we lift it? Do you want to do optional? What are you thinking? And so we're waiting to get that feedback before we actually roll out any kind of policy as it relates to these parents' own children.
And so whatever I was going to say is irrelevant because that's the reality, so that's important.
Well, I say this because I know that I know you're in it and you're on these panels. And I've always said, I want to watch the panels. Like I want to see the back and forth, because if you will, that I think that when people can see the questions that you might have asked on the panel and they could see these things play out in some ways, even if it's clips of it, I think it makes it a lot easier for people possibly to believe that you were standing up for them, that you were asking the tough questions and looking at the data in a way that makes them say, oh, wait a second. I know, what? He's the smartest person in the room for me because I know he's asking the questions that other people aren't going to ask. So I think sometimes it doesn't play out,
Right. So I like that question or that statement, Regina, because the meetings where these decisions are made are public meetings. I mean, you can, if you feel like sitting for 5 hours, listening to didactic, the discussion, the presentation, the questioning, and the final vote. So it's called the Advisory Committee on Immunization Practices, ACIP. That's who makes these decisions. The FDA says this vaccine is safe and effective. The ACIP says we're going to use it this way. So that's the way it really works. So people get on, and we actually put time aside for public comment. So the public, they can't ask questions, but they can comment. And so, and they're recorded. I mean, you can, like I said, it's all there. So it's wide open and in the public. So if someone were so inclined, you could just hear it all. And I think I would love that to happen. I mean, other people to hear it, because we have voted down stuff. It's like, no, some of the stuff, like there's been some the vaccine coming for children 6 months to 4 years, 11 months. That hasn't come yet. It was coming, but they decided that they weren't ready, the people who made it, because they kind of told us some stuff. We said, and they said, okay, we'll hold off a little bit. So that's what I'm saying. It is, the transparency is there, and I will not vote for it if I don't believe. I'll vote no be loud when I say it. You know what I mean? So
Right.
it's like that.
No, I think that's, I think that's one of those things that's really important for people to see, people to see people like you standing up for what's right. And I think whenever you become this is not like for a political discussion just for somebody who's popular, but you become the AOC of somebody fighting for somebody's rights on whatever side of the aisle, but just, you become that person, right? Who people see as, what, I can trust them because they're looking out for my best interest. And so I know that we're coming up on close on the hour. So I want to get a couple more questions in, but
I want to add to what you just said.
Okay, go ahead.
Because if my family saw Dr. Brooks, not watching a 5-hour meeting, but I will definitely post about this conversation, and they knew that he was fighting for what's right for them and their children and their grandchildren, it would be a no-brainer as far as I'm concerned, right? I believe that they would believe him. And
Thank you.
so again, it's just about who is in front of these families. Where are they getting the information? If we can draw our families to this video, I think it's going to do a lot of good out there in our communities.
And then let me ask one quick thing. I appreciate that. When I wasn't president of the NMA at that point in time, but afterward, around in November, December of 2020, when they were bringing the vaccines, the National Medical Association met privately with Pfizer, Moderna, and J&J. And we asked them all the questions. We asked about sickle cell. We asked about infertility. We asked about just were Blacks in the studies. I mean, we peppered them. They had to come back with some answers. So, I mean, we didn't no holds barred. We had the top scientists, the same ones that present to the FDA presented to us. So we were, I won't say we were skeptical, but we were not going to assume this vaccine was safe and effective in Black people until we spoke with the manufacturers directly, and we did.
So, as we look at this, and we know that obviously the goal is to get more and more families to choose vaccination for their kids, but we know that now there were mixed messages even about if someone is exposed, what they need to do. And so this question is, one for you, Dr. Brooks, but one for you, Dr. Bishop, as well, because, what do families do whenever you get exposed? About a few weeks ago, I don't really think that I had it, but they said that but my test came back positive, and then I took 3 more tests and I was negative on all 3. So I just have gotten to say that I don't think that I really had it, but, what happens, now, obviously masks are going to be coming off, coming on, or mixed messages or whatever, if exposed, how long do kids need to be quarantined at this point?
So I would say if we're talking, okay, if children are unvaccinated or under-vaccinated, it's versus fully vaccinated. So let's see, Dr. Bishop, you said K through 11. So she has, that's right, they're all K, it's 5. So they all are generally eligible to be vaccinated. So I don't even know what her schools do, but generally speaking, you have to quarantine for 10 days. I don't know if that's what they're doing now, but generally speaking, exposure is 10 days of quarantine.
Oh, wow. So Dr. Bishop, what is that doing with the school then in terms of, obviously case numbers are down, so hopefully they don't go back up. But what is that doing with the school? Because like I said, I think there were mixed messages. Some people were like, hey, you got to be 5 days now, go back to work. I don't know if they were doing the same thing. I know that people looked at that and they looked at that as a political move. I think our state did not do that. We held firm on, no, we're gonna hold back and we're gonna have people, quarantine longer. But are you guys experiencing mixed messages in that, or are you guys kind of holding to what not the federal, but basically what the state has said, what Dr. Brooks just said?
We've held fast for the most part to the 10-day rule. And, combining that with all the things we have to do around making sure that students have their instructional materials and putting them on Zoom and all of that. There have been some limited cases where we've done the 5-day rule, because again, we've got testing on our site. So, there's taking it case by case in concert with our nurses and making sure we're making the right decisions. But for the most part, it's been 10 days.
Well, I have just super duper enjoyed actually talking to both of you guys, and I feel like I could talk to you all night long, but I know that our time is going to be coming to a close soon. So I want both of you to, just take a minute or so to kind of tell us, if you wanted to leave one lasting message to, the community that may see this in the Bay Area, and that are, going to be watching it on the Oakland Post. What would you, what message do you want to leave to, our community? Dr. Bishop, you can go first, or.
Sure. I first want to just thank you, Regina, and California Black media for leading this discussion. Again, speak about trusted sources, right? So I can post this and I know my families will be all over it and want to know what you have to say as a facilitator and what we might have to say as your guests. I think, again, more and more conversations, more and more joining hands to learn what the facts are, and more figuring out what's true and what's not, and really monitoring what young people are watching is so important as we move forward. I am just appreciative that this is an opportunity to share what is real and what is not, and that California Black media is taking a lead. And so I just appreciate being a guest, and hopefully I've shared something that will help someone tonight. Thank you.
Thank you.
And Dr. Briggs, amazing. I appreciate you.
No, thank you. So I'd like to say, first of all, Oakland, I lived in Oakland for 8 years. I trained at Children's Hospital right there and practiced for 4 years up in North Oakland. So that, and met my wife up in the Bay Area. So I have an affinity and a love for the Bay Area. I do want to thank you, Regina Wilson, for being an excellent moderator, Kimberly Brown, and the whole organization for having this occur. I think about walking past Dr. Bishop's school, and if I look at it and say, every kid in that school is vaccinated, then I mean that would just warm my heart, because I know COVID has no place here. COVID will not find a toehold in that school and theoretically go out from there into that community. What we're going to see as we move forward, the people that are going to have problems with COVID are going to be those that are unvaccinated. It is going to be a disease, a condition of the unvaccinated. I think that we as African Americans have to understand that America as a country has a concept of rugged individualism, but that does not work for the Black community. We are a community, we work collectively. It takes a village to raise a child. And so that village has to be vaccinated. And so we have to embrace those that are unvaccinated, not eschew them, bring them into the fold, and however we can do it, get them vaccinated. And that's the only way we as a Black community will get to the other side of this pandemic.
I want to thank both of you for joining us this evening. I appreciate your knowledge, your time, and your candidness. Your insights have been helpful, and I hope that something you've said has had an impact on someone listening. Before we end the conversation, I want to encourage you to remain safe and healthy during this pandemic. Remember that vaccines are how we get through the pandemic, so please get fully vaccinated and boosted, and get tested if exposed to the virus. If you have symptoms or traveling, stay home when you're sick. Be safe and be well.